Good afternoon, everybody, and welcome to our Sunday afternoon 1MD live show. Thank you, Dr. Joshi and Dr. Shetty, for joining us in this new year. Firstly, I would like to wish you both and our audience a very happy new year. We've started the new year, very well with a little bit of hope with new vaccines, new drugs, and all of that we'll get to know. There is also a little bit of scare from the earlier year, which is of Omicron. So today, what we are going to do is do a very sharp Omicron demystifying myths versus facts episode. So please go ahead and ask the questions. We'll, of course, have Dr. Joshi sort of clear it out for us. But if you have any doubts, please post them in the comments. And then we'll ask Dr. Shetty about how to deal with this fear that's going on because of Omicron, whether we should go out, not go out, and how to deal with this uncertainty. So, Dr. Joshi, I'll ask you first to go ahead and start with the demystifying of certain myths and then what are the real facts regarding it. Dr. Joshi.
So happy New Year, everybody. My happy New Year also goes to Guru Anna, Dr. Shetty, and Anirudh. Thank you so much for continuing this. And today our focus discussion is going to be COVID-19 and the whole COVID Omicron and the third wave. Are my slides visible, Anirudh?
Yeah, they are in the slides mode though. Like you can just click on the leftmost item, the leftmost icon.
Means
Uh, all of your slides are visible at
one second.
once instead of.
So I need to do what?
Just click on the first one instead of the middle one, the one that you have clicked right now. Just click on that first one.
I click on the first slide.
Yes. Now your slides are visible. You can just go down from the left.
Is it visible now?
Yeah, it's visible. It's visible.
You can
And
click,
now is it moving? Is it moving?
No, it's not
no, you can
moving.
click the wine cup on the
Yeah.
bottom.
Yeah, you can just go down the slides, Dr. Joshi, from the left side.
So this is visible now. Is this visible
Yes,
now?
yes. This is visible. Yes.
So today we are going to discuss COVID-19 and Omicron and the third wave. And we all know that it's a very, very rapidly transmitting virus. And this is a slide which Dr. Manoj Jain from Emory has made, that the virus is determined by the transmissibility, severity, and mutations. And the original strain, Wuhan strain, was transmissible in a R naught between 2 and 3. The Delta strain was almost double. But Omicron is nearing measles, and that's why we are worried about Omicron. And therefore, Omicron had this real viral competitive advantage. And that is why, on November 26th, just a month back, we had this virus named as a variant of concern by WHO. So what do we know about Omicron? It is rapidly transmissible. It is a super mutant. The R naught is not known, but it's as fast as measles. It is replacing Delta very fast. It has an immune escape. That means if you had COVID in the past, if you have taken 2 doses also, you will still get it. And the severity of virulence is unknown. Early trends are it's mild. It causes less severe disease. It affects the upper airway and lower airway, but not the lungs. So those are the good things. So if you want to summarize, Omicron can spread even by simple talking for 3 to 5 minutes for a short duration when you unmasked. And therefore, masking yourself completely, properly, appropriately with the right filter. Even if you have a cloth mask, take a 3-ply surgical mask and ensure that you're fully covered is very, very crucial in Omicron times. It is worrisome because it can bypass antibodies, enhance transmissibility, and increase infectivity. Therefore, what we know is it came from Botswana and South Africa. Highest transmissibility, low disease severity, and escapes natural infection and antibodies of vaccines. It can be easily picked up by the S gene deletion. So we have 3 types of COVID now. One which is not vaccinated group, very rare, no vaccine taken, has got COVID for the first time. And this is called as the native infection. Most patients will now be at least with 1 or 2 doses of vaccine. And there will be a small group which had COVID in the past. So there are 3 types of COVID which you see every day today. People who get it for the first time with 0 vaccination and 0 immunity. People who will get breakthrough after 2 doses of vaccine, and people who had COVID in the past get it again. And we are seeing all these 3 categories as we talk today. It's all about immunity. So our body normally 95% of Omicron will be cleared by body's adequate immune response, which means that our adaptive immunity will make interferon like substances and they will clear the virus by macrophages, the T helper cells, the B cells, making neutralizing antibodies. But some few who are vulnerable, who don't have good immune response, they will have a challenge. And that is what will be seen very clearly. The other thing which happens is that most of these patients will be having the so-called early infection. And that is something which we need to recognize, that in Omicron, these flu-like symptoms will be seen in 95% of cases. 4% will get shortness of breath and 1% may deteriorate. So this whole old matrix was 80, 15 and 5. That will become 95, 4 and 1 respectively. So the most people will be in the early infection phase, some people will be in the lung phase, and very few people will be in the inflammatory phase. So who should we be bothered in this Omicron pandemic? If there is a senior citizen at home, somebody has lung disease like asthma or chronic pulmonary lung disease, heart disease or diabetes, obesity, chronic kidney disease, immunocompromised state or organ transplant survivor, they are the risk categories and they are the people who we can manage. Today, COVID can be very easily managed. Whether it is asymptomatic COVID, you just need monitoring. If it is a mild disease, we give antiviral therapy. Then sometimes if your Delta strain is detected, we give antibody therapy. Moderate illness, severe illness can all be managed. So it is all based on a evidence-based medicine. But the simplest test to do for everybody, suppose you get COVID, what you should do? Don't panic. You can do simple test called complete blood count. Look at the red cell width. If it is more than 14.5, then you are likely to deteriorate. Look at the CRP test. CRP is also very cheap. If it is high, then you are likely to deteriorate. Then you should go to your doctor and get admitted. If you additionally do D-dimer, LDH, ferritin, IL-6, then if it is high, then you are likely to deteriorate. So every patient who gets COVID, you have to manage at home by having a thermometer at home and an oxygen saturation meter at home. If your temperature is persistently above 100, take paracetamol round the clock, 500 or 650 milligrams. If your pulse rate is very fast, if your respiratory rate is very fast, then you should talk to your doctor and get admitted. If your blood pressure and sugar is high, connect with your doctor and get the right medicines. If it is persistently high or very, very high, go to the hospital and get admitted. But the main COVID thermometer is the pulse oximeter and look at the oxygen saturation. If the oxygen saturation after 6-minute walk test drops to 3% or below, then you should again get into the hospital, or if it is less than 93%, and be connected to your doctor. The main thing is when you look at a pulse oximeter, it's winter time. So please warm your fingers, because if there is vasoconstriction of the fingers, that means the finger capillaries get constricted and you might often get a reading of 80 and 70. Don't get scared. Just warm your fingers and ensure that you use the middle or ring finger, remove the nail polish, remove the mask and then measure it and wait for 60 seconds before you measure the pulse oximeter. Remember, COVID timetable is still 14 to 21 days. The first 14 days are very important. First week you get lot of symptoms. Second week you get no symptoms, but you have to be on high alert. And usually it takes 21 days to become okay. Post-COVID syndrome may be seen in Omicron. We don't know data on that. So right approach, right time, right medicine is very important. Don't just go and binge on antibiotics or antiparasitic agents, and ensure that you speak to every person who is suffering from it. Who is at risk? Suppose you are male, you are elderly, you are having diabetes or immunocompromised state or obesity, blood pressure, heart disease, heart rhythm disorder, heart failure, kidney failure, lung failure, liver failure, brain stroke, neurological issues, or if you are short of breath, then you are at risk to die. And only if you have Delta, you might respond to the cocktail antibody. Or if you have, and who is at risk to die, as I told you, obesity, CKD, diabetes, immunosuppressed patients, and senior citizens. So do we have treatments today? Well, favipiravir is still there, but it has to be used very early. Now we have molnupiravir available. It may be used under medical supervision. We have monoclonal antibodies. The current monoclonal antibody may or may not work for Omicron, but for Delta strain it works. So it's very important to distinguish. Right now there is Delta and Omicron both. So your doctor will distinguish it. And if you go to hospital, we have remdesivir, we have steroids, we have tocilizumab, itolizumab and everything. If you have persistent cough, then you can take 2 puffs of a budesonide inhaler. And sometimes now we will have an oral tablet which is really available, which is a chain terminator. It is called as molnupiravir. What it does is, it works against all variants, but in 3 days it makes you negative. That is the big advantage. It clears the virus very fast. And there is a 30% reduction in hospitalization and deaths with molnupiravir. So compared to the old favipiravir, this medicine is very effective in saving lives. And there is data from India also, which has shown that it works in the Indian population also. and it has side effects like nausea, diarrhea, and headache. So mainly molnupiravir has lesser hospital admissions, faster clinical improvement, and early negativity. So this was the old treatment, remdesivir, steroid, and oxygen. And now the new treatment has molnupiravir and the antibody treatments, and a lot of new antibodies are also going to come, like sotrovimab, and now the new Pfizer drug, which is the Nirma Trelivir with ritonavir, may also come. Remdesivir also can be given at home. All these medicines will come in very fast. So obviously, currently we have to look at three things. One is the virus. Is it more transmissible? Yes. Is it more severe? No. Does it have a lot of mutations? Yes. Do we need to boost our immunity, B and T cell? Yes. And look out for immunocompromised states. But we don't want to, we'll have restrictions, but we may not have any lockdowns. We need to be distant, and we need to wear a mask, and we need to get vaccinated. So wear a mask, wear a vaccine certificate, and ensure that who identify people who are at risk. If you're a senior citizen, if you're obese, or if you have any chronic illness, you are at risk. Ensure that whether you're vaccinated or have previous infection, you're still at risk. And we have to look at oxygen availability and bed availability. That will determine, don't go by the numbers. 6,000 case aaya, 10,000 case aaya, doesn't matter. And now we have new antivirals and monoclonal antibody both available. So obviously the number of admissions will be less. Omicron has shown that in beta wave in South Africa, 13%, 10% in Delta wave, and 3.8% in the Omicron wave. So today our goal is zero COVID deaths, no severe disease, mild manageable endemic disease. So it may be a chain breaker. So we need to be responsible, because that is the main thing which we need to do when we are managing COVID in a better way. And that is what we need to recognize, and we need to, ensure. So remember that Omicron is very much around. It is very, very rapidly transmitting. There is no need to panic. We just need to use common sense and prudence to manage it better. And all it needs is a supervised treatment. All it needs is a supervised treatment. And we can be out of it. The 3 W's are that you should wear your mask, which is properly fitting. Properly fitting, number 1. Number 2, if possible, wear a double mask. Secondly, wear your vaccine certificate and ensure that you are doubly vaccinated. If you are eligible for a booster, go and take the booster. Okay. And third is, watch your distance. Watch your distance from other people. So if you do that properly, you can come out of it. At the second day of this year today, we need to be very, very proactive, very cautious, very careful, not reckless. But I think we have to see the end of this endemic and make the pandemic into an endemic and make it a chronically or acutely manageable condition. Only we need to red flag it. The problem is that if the numbers go up very fast, our healthcare infrastructure can get burdened. And even then, even if 1% or 0.5% people die, that number will be very huge. So we are all ready, but we need to be strong. We need to have a lot of resilience. And there's a lot of fear, a lot of anxiety. So the virus in the body is fastly transmitting. So suppose you are having a glass of water or a cup of tea with your friend. In the past, probably it would have taken for Delta to transmit 15 minutes or 20 minutes. This may transmit in 5 minutes. You can get it in a lift, you can get it in a corridor. So please ensure that you double mask. You come home and eat alone in your bio bubble. That's the way to go. I thank all of you all for bearing 2020 and 2021. They were difficult years. But we are looking at the sunrise year, which is 2022. We might get another variant of concern. I'm not denying that. But we have to face it bravely. We have to face it rationally. And we have to face it in a non-emotive way. The anxiety levels are at the peak. I can see Guru Anna has been overworked. He's going to now take over and give us, because all of us are tired. In fact, Guru Anna is counseling most of us to handhold us how to handle this problem better, how to walk the path in these difficult times of Omicron days of the COVID era. First era was the ancestral strain of the Wuhan phase. Second state was the Delta phase. And now is the Omicron phase. Guru Anna, please guide us and handhold us how to break the Omicron fracture in the mind and how to heal it.
So first of all, I'm asking you guys, is there a fear of Omicron? Well, when I sit in my clinic and Dr. Shashank sits in his clinic, we all believe and we all feel that a lot of people are asking questions. But a large number of people are doing what they're supposed to do. There's some amount of not denial, but indifference. And
Yeah.
there's some amount of thought that is settling in the minds. Oh my Quran, अपना cold cup जैसा है, आएगा
Hmm.
जाएगा,
Hmm.
ज़्यादा चिंता नहीं करने. And also, there's a lot of uh, hostility against any lockdowns, fatigue against any lockdowns.
True.
Let us continue life. We are not ready to be interrupted. We are
Correct.
not ready to be stopped. We are not ready to close shops, close clinics, etc. We will continue working. And that, I think, is the philosophy largely which we see across the country,
Yeah.
because me and Shashank are connected across the country with not
Hmm.
only doctors, but with the people of India.
Yeah.
And when you're connected to the people of India, you get this picture. Having said this, yet Dr. Joshi has said all the basics which you need to do. But what is also very important is that that the fear has to be managed. So the latest data
Hmm.
by Kasturba Hospital in Bombay, who collected samples to test for Omicron, found that every sample was not an Omicron variant. Almost half of them were not Omicron positive. So, what is very important for us to understand is the Delta is still around.
Yeah.
And so we need not to be careful about Omicron, we need to be careful about all other variants which are there.
Absolutely.
Now for example, if somebody says, will you come for a marriage in Lonavala, you need to ask questions to bring down your fear. How many people are going to attend? How's the food going to be served? And what is the COVID friendly environment there? And there's no shame in asking this at all, because you're talking about lives, you're not talking about fun, we're not asking for fun, we're asking for safety and care for ourselves. And then if they say it's only so much, the area is vast, and the food will also spread across, and then you might safely go there. If somebody says that New Year's party we could not hold because of Section 144, we're having a small party in a house, and then check how big is the house, and check how many people are coming, and check the COVID sensitization. Is it present in the family? So when you do the fact check, your fears are managed. Facts bring down fears. Lies increase fears. So don't rush anywhere you're invited, and see to it that you continue being alert. Eternal vigilance is the price of liberty, said Jawaharlal Nehru. That is so important. The third most important thing is your children, your teenagers. They're not going to listen to any curbs, but slowly, mindfully turn their screws around and say that let us cut down our activities by 25%. Let's increase the space between two people by approximately 50%. Cut down activities, increase the distance among people. And that is so important. Thirdly, you may have to go to a hospital for other checkups. You may have to go to hospital for actual operations, etc., etc. So see to it that your consultant is mindful about COVID. If he is mindful about COVID, then you will be also very mindful about COVID. Emergency, you need to go to a different city. Somebody died, close relative, and you have to go. See to it that your airlines, your travel, and the place where you reach is COVID appropriate, and that is important. Along with all this, do not stop your mindfulness exercises. Do not stop your exercise and your sleep, and do not stop the connectedness, which we have been talking about right from the start of our show 2 years ago. And the connectedness with people who are mindful is more important than connectedness with people who are reckless. So connect with mindful people, live your life. And almost all my friends who have been infected recently and their family are perfectly safe. No oxygen drop seen. They are taking only paracetamol as advised by the doctors, and I've yet to see anybody who's at risk in my hospital or among my own friends. So, guys, enjoy, but enjoy mindfully. Taking care of the facts brings down fears. It's not only yoga and mindfulness. At the same time, do not watch contradictory news. Follow the government guidelines and your state government guidelines. Do not watch news which is very contradictory and which has no basis.
Wonderful, Dr. Shetty. That was so nicely put. Dr. Joshi, we have a whole lot of questions that have come. If you don't mind, we can go through some of them.
Yeah,
First,
should. We'll do a
yes.
rapid
Okay.
fire
Yes,
with me,
yes.
and then we can do a rapid fire with Guru Anna also.
Okay. Dr. Virendra Goel says, Happy New Year with greater than 50% population infected by now, greater than 150 crore vaccines. Where is the word herd immunity? That's his first question.
So, Dr. Goel, it's a fantastic question. With every strain, there is immunity, but once that strain vanishes, the immunity goes. So we had immunity maybe for the Wuhan strain or for the Delta strain, but if Omicron has arrived, that immunity is lost. Advantage is when you build some immunity, B cell and T cell, you will get mild disease. So one of the reasons the world is seeing the milder version of Omicron is because we have got some degree of non-specific immunity. So that is the indirect proof. And we are seeing and witnessing that in Mumbai and Delhi, and we will probably see it all across India. So that's the answer to that.
Divya Desai says, what treatment is there for Omicron and which doctor to visit? You've already covered the treatment, but
Family
you can...
doctor is good enough.
Yeah.
Symptomatic
Yeah.
treatment is the order of the day. If hit hard, it hit early. You can use drugs like molnupiravir, but mind you, they were all in the pre-Omicron time when they were discovered. So we don't know the effect of all these drugs on the new version, but it should work. Is a presumption.
Dr. Virendra Goel's second question is scope of ivermectin, favipiravir, colchicine, steroids, mefenamic acid.
Favipiravir may work. Colchicine unlikely to work. Steroid will work only very late. Mefenamic acid or ivermectin are, we don't have any data on this.
Okay. Is molnupiravir available now in India?
Yes, available as 200 milligram tablets, 4 tablets twice a day for 5 days. 13 Indian companies have collaborated with Merck, which is the innovator, and it is available in India. But point is that it is 40 tablets only to be given in a small population very quickly, very fast, very early.
Okay. Dr. Vandana Gupta says, how many days will it take to show that one is infected by meeting somebody?
Maybe 3 days. The doubling time is 1.5 to 3 days. So usually within 3 to 5 days, you may get infected. It's a very fast spreading virus. You can get as infected as early as 6 hours to 3 days. But 1.5 to 3 days is the standard doubling time.
Sonal Jasraj Ashar says, I have a question for Dr. Joshi. Self-kit shows negative and thereafter the lab report is positive. What to make of it?
Then Sonal, you are positive. So then you have to go by that because rapid antigen test has a sensitivity of only 40%. RT-PCR is 70%. So obviously RT-PCR is more sensitive. And if there is H gene deletion which is seen there, then it's likely to be Omicron.
Okay. Dr. Gauri Bhumkar says, what is the logic behind sealing multi-story buildings for 5 or more patients?
Rapidly spreading virus, so containing the virus. Micro-containment. It's called as a strategy of micro-containment by Government of India.
Okay. Chandrasekhar Reddy says, is Covishield and Covaxin effective against Omicron and Delta variant?
Answer is that Covishield and Covaxin are effective against Delta, but for Omicron, we don't know the answer.
Okay. And can we mix and match Covishield and Covaxin as booster dose?
No direct guidance, no direct evidence, but scientifically plausible.
Okay. All right. What is the treatment protocol? Again, similar question. Fast spread means fast normal.
Treatment protocol is measure temperature, give paracetamol. Persistent cough, give inhaled budesonide. Persistent cough, persistent fever, CBC high, RDW high, CRP going down, get into the hospital and leave it to your doctor. Doctor will decide. Early in the disease, you may be offered molnupiravir. If you are Delta, you may be offered a monoclonal antibody.
Okay. And when to decide when to go to the hospital, Dr. Joshi?
Red flag is if you are desaturating, if your doctor feels, if you have a lot of comorbidities, you have immunocompromised state, and if you have uncontrolled disease, if you have persistence of fever, persistence of cough, breathlessness, desaturation, by the saturation dropping, then you should go to the hospital.
Okay. His follow-up question is on Mohan Deshpande says oral steroids.
Only if the saturation is low. Only if the saturation is low in the hospital setting, not to be given at home.
Not to be given at home. Okay, excellent. Any change in guidelines for isolation or quarantine period, Manish Azmera?
No, right now our standard guidelines remain the same. It is 10 days.
Okay. If someone is infected and cured from Omicron, will he be immune to all earlier variants and for how long?
Ranganathan, we have no answer for this question. We'll get the answer in times to come.
Okay. What's the protocol for isolation for family members specifically?
5 days and test negative. after 5 days.
After 5 days. After how many months should booster dose be taken actually?
9 months is what government of India said, Bina.
Okay. Doctor, with so much infection seen all over the in a short period, are we moving towards the endemic?
We don't know, but if the Omicron displaces Delta and the
Hmm.
Delta becomes mild and the number of cases dramatically come down, then we'll call it endemic.
Okay. And
For it to be
also,
called endemic, that the pandemic has to end.
correct.
But Anirudh, you can send him my editorial in Japi in the last month of
Yes.
December.
Yeah. And also another strain has to not come, right? Is that's
That's
also
correct.
another?
That's right.
Yes. Okay. All right. We can move on to Dr.
Dr.
Shetty.
Shetty.
Yeah. Dr. Shetty, I have a question for you. Yeah, there's a whole lot of confusion regarding schools and children playing in the parks, etc. We have answered these questions multiple times, Dr. Shetty. The thing is that as parents, people are still having questions now that with this Omicron variant, should people be sending their kids to play in the building compounds, or should they be going in the parks, etc.?
Absolutely. I think they should be playing in the building compounds with the same protection which we have been used. Don't go down on the protection at all. And the same SOPs which have been described for schools should also be applicable and used in schools. But what is important is that messaging to your kids is more important than what they do. And what is actual messaging? Use words like uh, please, I'll be so happy if you keep your masks on, my dear
Hmm.
son or my daughter. I'll be very, very happy. Don't provoke fear. If you don't keep your mask, you'll kill all of us. No, I'll be very happy. I was so happy to see you with your mask on when I came from my office when you're riding a cycle. And so reinforce good behaviors positively, negatively reinforce bad behaviors by sitting down and having a conversation. There are so many children who are saying, we don't care about the COVID, we will do what we want. Enough of all your instructions. I mean, this is what a lot of young boys and girls between 12 and 18 are saying. At that time, allow them to express their frustration because it's a very valid frustration. You
Hmm.
mother
Hmm.
can't really keep these kids inside locked doors for a very long time. So allow
True.
their frustrations to actually emerge and let them be exposed to some basic information of Omicron and
Hmm.
and Delta, and show them that this is again, as we said, a slow Tata virus, most probably this is going, but for a short time, you still will have to put your masks on. Like, for example, when somebody is wearing a raincoat in at the
Hmm.
time of rains, we say, no, the rain is gone, the heavy showers are gone, the drizzle is there for a short time. Wear this raincoat for 15 more minutes, and that is
Hmm.
what should be done. Number three is that though all this happening, parents are facing a lot of problems in their workspace with
Hmm.
respect to salaries, excessive work, high demands, and a lot of pressures on the workspace. So a little more mindful continuation of exercises, all those activities which help them to relax should
Hmm.
also be a part of their entire menu. The other day, somebody said that one man said that I cooked a dish and that gave me a lot of relaxation on a Sunday, and I felt good on a Monday. Somebody
Hmm.
said that I went to a place where I've not gone for a very long time. That was a place where we used to go every day, and that is so beautiful. I have
Hmm.
started going to the beach for my own mindfulness, apart from all the other things I do. So look for small things which you can do so that your frustrations are also lowered and you can actually take care of your kids. But I would like to ask Dr. Shashank, what is the Israeli new cocktail of flu and Omicron? Number two, a cardiologist from Israel or United States of America almost said that Omicron is a vaccine for the world. So, would you please share your answers to these two questions?
So a lot of people feel that Omicron is like a natural vaccine. That's very wrong because any infection will have its own side effects, and Omicron can also kill. 12 people have died all over the world due to Omicron. Number two, Omicron can cause long COVID. We don't know long-term implications of Omicron, so it is not a natural infection for sure. So there is no scientific basis to that substance. But if it infects a large population, it may cause some degree of herd immunity. But herd immunity theory has failed if a new strain comes. Omicron is a new disease where you get double disease. Like we got dengue with COVID, malaria with COVID, like that you can get flu with COVID. If you get flu with COVID, it's called Flucron. Like there is a new term called Delmicron. Delmicron means what? Omicron and
Delta plus Omicron.
Delta, both simultaneously in the population, not in the same person. Similar to that, Flucron means normal influenza happening because it's influenza season because of winter, and Omicron at the same time. So you can also get double infection. That's all it means.
Okay. Some questions I'm going to take again, Dr. Joshi. If Covaxin and Covishield are actually not working against Omicron, then what is the use of taking the booster?
I didn't say they don't work. We don't have data on them.
Right. Gurudevi Galurgi says...
Remember two things. Vaccines all save lives and severe disease. The current vaccines are early generation vaccines. They are not sterilizing vaccines. So they are immune boosting. So they are boosting your immunity to ensure that you get a milder form of the disease and you don't get severe disease. You don't need a lung ventilator or you don't die.
Right.
So it is life saving for sure. But the problem is that they don't obstruct or they don't prevent you from getting infection.
Correct. Gurudevi Galurgi says, my mother's O2 level is 91. Should we go to the hospital?
Yes, please. Immediately go to the hospital.
Okay. What is the
Unless
severity?
until she has an underlying unless until she has an underlying COPD, chronic lung disease, she's under treatment of a lung doctor, then consult a lung doctor.
Makes sense. What is the severity in kids under 6 months?
We have no experience in that. But usually children do very well. And even if they get severe COVID, usually most children do very well. Their mortality rate is very low. And they get IV immunoglobulins if they get it also.
Renuka Satish says, when other children come home to play with our granddaughter at home, what should be the precautions?
If one can avoid it, nothing like it, because we don't know the exposure of the other children.
Okay. All right. Should offices go back to 50% attendance? Vandana Gupta ji says.
Currently, offices can work from home during the peak of the pandemic for next 2 weeks. It is ideal. If they can't work and if they go back to the 50% attendance or lower attendance, then what should be done is that they should be having no air conditionings. They should have open air, and whenever people unmask and eat, that should be staggered eating timings.
Okay. Pratap Chakrabarti, last question. Is Covaxin safe for kids 15-18? Can I send children to school?
Covaxin is absolutely safe. In fact, among all the vaccines available today, the killed Covaxin, which is a Make in India, Made in India vaccine, is very safe for that age group. In fact, the adenoviral vaccine like Covishield can have side effects. So can mRNA vaccines of Pfizer. So compared to them, where there is a reported adverse event, Covaxin is the safest vaccine available. There is also one more vaccine approved, which is the Zydus COVID, but it is 3 doses. So Government of India has recommended Covaxin.
Okay. Your last thoughts, Dr. Joshi, and then we'll ask Dr. Shetty to close the show.
My last thoughts are very simple. We are at the peak of takeoff of a new wave of COVID, which is the third wave. Third wave in Mumbai has started. Third wave across India will also start. Very clearly, we need to handle this with caution and care, not with complacency and recklessness. So again, responsible behavior is the key. Avoiding crowds is the key. Going into poorly ventilated space is hazardous unless until you are properly doubly vaccinated and doubly masked. Double vaccine, double mask. The 3 W's are: wear a properly fitting double mask, wear your vaccine certificate with 2 doses or an extra dose on board, and be watchful of the distance and stay distant from people. If there is non-priority work which can be, or a work which can be managed virtually, there is no need for a physical meeting. And when you are unvaccinating, there is a socialization where mask needs to be removed for having a cup of tea, which is social in nature, can be avoided, should be avoided.
Excellent. Dr. Shetty, your last thoughts.
Well, if there are politicians on the show, I would request you all to tell all your leaders to behave appropriately. Most of the politicians do not wear their mask. And people follow you. The Praja actually follows you. We saw politicians in Maharashtra in a marriage where hundreds of people had joined. We saw politicians in Delhi and in different states having election victory rallies. Ye nautanki ban kijiye. जैसे आप लोगों ने कहा शादी में 50 लोग, सिर्फ 100 लोग, होटल्स में आधा आधा सीट्स, थिएटर में आधा सीट्स, ये बहुत अच्छा है, ये जरूरी है। बट आप नेतागण ने बिल्कुल इसके इसके बिल्कुल विपरीत आपने किया, तो लोगों के भी जहन में ऐसा लगेगा जैसे नेता वैसे प्रजा। And I would request all leaders, not only politicians, all leaders in different spheres of life, not to touch your face and your mask. And please take on the Hanuman avatar. The Hanuman avatar is very important for some time. Then you can take Ram or Vishnu avatar, and that is perfectly all right. So I appeal people from all sections to be responsible. And remember, life is above all victories, and life on earth is above all wars. And seeing to it that we behave responsibly so that the world around us behaves very responsibly. Thank you.
Thank you, everybody, and thank you for joining again. Happy New Year to everybody. Thank you.